The words quarantine and isolation have gotten a lot of use over the past year, but they're not always used accurately. Many people also aren't sure what they need to do to protect others if they've been exposed to or diagnosed with COVID-19. We at COVID Core wanted to help clear up what quarantine and isolation mean, why they're important, and when you need to do them.
When patients have symptoms that could be COVID-19 symptoms, such as fatigue, body aches, new loss of smell or taste, a sore throat, congestion, fever or chills, cough, shortness of breath, nausea, vomiting, or diarrhea, they should immediately contact their doctor and get a COVID-19 test. When patients have a positive COVID-19 test or suspect that they have COVID-19, they should contact anyone that they were in touch with and they should quarantine. When they themselves are positive, they should isolate. Isolation is separating someone with an infectious disease from other people so that they don't spread the disease. This is a very routine thing that we do in hospitals to prevent transmission. Quarantining is when someone without a known contagion but may have been exposed to a contagion stays home to prevent the spread of the disease.
Let's talk more about quarantine. Let's say you provided care to someone who was sick with COVID. You may have had physical contact with the person through touch or shared eating or drinking utensils. Maybe they sneezed, coughed, or otherwise got respiratory droplets on you. You definitely breathed the same air. Or imagine that you had a friend over to your house and shared a meal with them, talking and sitting at the same table, and then found out they were COVID positive at the time. These are all examples of close contact. If this happened, you would have to quarantine for 14 days after being around that person. Quarantine doesn't mean just limiting your activities to essential errands or practicing social distancing. All of us who can should be doing those things no matter what. Quarantine is specifically when someone who's been exposed restricts their movements until they know whether or not they've been infected. While you're quarantining, you should not have in-person contact with anyone outside your household for 2 full weeks. Quarantining includes not going out for any errands, not even for essential activities like buying food. Depending on where you live or what your circumstances are, fully quarantining simply might not be possible for you. But limit your contact with others to the maximum extent possible, and if you do need to have contact with someone, do it as safely as you can, at a distance, wearing masks, in a well-ventilated space, and for short periods of time. If possible, during the 14 days, do your best to stay apart from other people in your household as well. Sharing a household isn't a guarantee that everyone will get sick if one person gets infected, so it's still worth it to cut down on close contact as much as you can during quarantine. A lot of us have heard the guidelines about being within 6 feet of someone who has COVID-19 for a total of 15 minutes or more. But even if an exposure doesn't fit these criteria, it can still be a good idea to quarantine. For instance, if you were talking with someone in the same room for an hour with no masks on, even if you were 8 feet apart, and it turns out they were infected with COVID-19 at the time, it's still a good idea to quarantine. Similarly, if you were in a car or another small space with a sick person for 5 or 10 minutes, that could still be enough for you to become infected, and it would still be smart to quarantine if you can. A lot of people wonder if they can get out of a 14-day quarantine by testing negative, but a negative test doesn't necessarily mean you're not infected. If you have an exposure on day 1, get tested on day 3, and get a negative result back on day 7, you might think it's okay to go out and break quarantine. But you could already be infectious without knowing it. If you got tested just a few days after exposure, the test might just not have picked up your infection yet, or something else might have gone wrong. This is why it's important to quarantine even if you get a negative test. You might have seen the news of the test widely used in Los Angeles that is very likely to give false negatives in people who aren't showing symptoms. Even tests that are very reliable can fail to pick up an early infection, so you should still finish out a full 14-day quarantine even if you get a negative test. It's important to remember that viruses spread more easily when people aren't wearing masks. Whenever people are sharing a space, all of them should be masked for safety. If you were at your dentist's office and your dentist had a mask on but you did not, and your dentist was COVID positive, it would be very important to quarantine. Now, let's talk about isolation. While quarantine means staying away from others to see if you become ill, isolation is what you do when you know you are COVID positive. Under isolation, you must not be in close contact with anyone, if possible, even people in your own household. This can be really challenging, especially if you live in a fairly small place or have to share a bedroom. If you are COVID positive and you have the option to use a separate bedroom and bathroom, do so, though we know that's not realistic for most people. How long do you have to isolate? Generally, once a person is symptom-free and 10 days have passed since they first showed symptoms, it's likely safe for them to leave isolation. If you've had a fever, you need to have been fever-free for 24 hours, without the help of fever-reducing medications like aspirin or ibuprofen. Since COVID can have lasting effects on the body, you might be wondering what it means to be symptom-free. Some symptoms, like headaches and loss of taste and smell, are seen in contagious COVID patients, but can also last for weeks or months after recovery, and may not mean you're still contagious. Talk to your doctor if you're not sure. In short, if it's day 10 after your symptoms started and you feel totally healthy, you can stop isolating. If you have any lingering symptoms, talk to your doctor first about how you're doing and whether it's safe for you to stop isolating. Let's summarize. What do quarantine and isolation have in common, and how are they different? Both quarantine and isolation involve staying separate from other people. Both quarantine and isolation should be completed even if you get a negative test result. Quarantine is for people who aren't sure yet whether they have been infected. Isolation is for people who are definitely infected. Quarantine lasts for a fixed period of time, 14 days after the exposure. Isolation generally lasts 10 days after symptoms started, but only if you're symptom-free by the end of that period. Talk to your doctor to make sure it's okay for your isolation to end. Even if you're not under quarantine or isolation, remember that we all have a part to play in preventing COVID. Limiting our contact with others, even when we're not formally under quarantine or isolation, can help control the virus's spread. If you need to be around others, use masking, social distancing, ventilation, and good hygiene to make it safer. Working together by staying apart can help us protect ourselves and each other.